It is my great pleasure to introduce our respected
This meeting is
speaker.
being recorded.
It is my great pleasure to introduce our respected speaker, Ms. Tasnim Ali, RDN from USA. She is a CDR certified registered dietitian and nutritionist from the USA and an AADE level 2 trained diabetes educator from the USA that reflect her strong international credentials in clinical nutrition and diabetes care. She completed her MS in nutrition from the College of Home Economics from Pakistan, and she has also served as the former chapter head of the Pakistan Nutrition and Dietetic Society, that showcasing her leadership within the professional nutrition community. So currently, she is serving as a consultant nutritionist at Butch International Hospital, Multan, and she is also associated as a consultant nutritionist with ELSA Pakistan and Dermix. With her extensive clinical expertise, especially in the diabetes management and medical nutrition therapy, we are truly honored to have her with us today. Please join me in welcoming Ms. Tasneem Ali to present her talk in 7 minutes. Thank you so much, ma'am, for joining us. Over to you. Please start your talk.
Thank you so much for such a kind introduction. Assalamu alaikum and hello to all. Based on where it is afternoon or good morning to everyone throughout the world. I hope everybody is doing fine and happy Ramadan to all of you. Thank you so much for such a kind introduction. Um, I have I will try to go through quickly just to give you an overview regarding the Ramadan guidelines related to diabetes management, as well as keeping in mind the obesity. Obesity, diabetes, and Ramzan is such a crucial combo, is such a triangle that we need to be very careful about the things, the foods we eat, and how we actually relate to physical activity, how do we manage it. But we have a wonderful document from IDF DAR Guidelines 2021, which is based on such a long and comprehensive research and studies, which guide us that when managing, especially the type 2 diabetes, is the dilemma is that hypoglycemia or hyperglycemia or dehydration, significant weight gain, significant weight loss, electrolyte imbalance, and sometimes the fear of having acute renal failure in case of severe dehydration in the people who are already prone to developing kidney disease, etc. So the first thing, the planning for fasting in Ramzan for the people who want to fast, its planning starts almost 6 weeks before the Ramadan, when the persons with diabetes should visit their primary care physician or endocrinologist and get their clearance done. Their HbA1c should be checked, their glycemic control should be monitored, their medication should be adjusted by the endocrinologist to see if they are fit to fast in Ramadan. So it does not start on the first of Ramzan, it starts 6 weeks before the Ramzan. If the endocrinologist give them clearance to fast, that their HbA1c is within normal range or within acceptable range, and they are taking care of it well, and then the medication adjustment is also required. Usually the night medication is moved to the morning medication, and morning medication dosage is adjusted according to the afternoon medication, so the patients won't experience hypoglycemia, especially during at the end of the fast, and they won't experience hyperglycemia after the iftar. Other than that, the important thing to take care of is the breakdown of carbohydrates. When we are talking about a person who has diabetes and taking three consistent meals, carb consistent meals, then almost the total carbohydrate allocated. I will not go into the detail of how do we calculate the recommended amount of carbohydrates, but American Academy of endocrinology, American Diabetes Association, all of them recommend that there should be carbohydrate consistent diet for the persons having type 2 diabetes. But when we are coming to Ramadan, we don't have three meals, equidistant meals. There's a big gap between one and the second, between Sehri and Iftar, and then there is a close gap where we can adjust snacks. So the breakdown changes according to the IDF-DAR guidelines. That if it's for a person, for example, a person is required to have 150 grams of carbohydrates per day, then almost 30% of it should be coming in the Sehri. And they should be coming from the complex carbs. What are the complex carbs? Complex carbs are which have more fiber, more protein, and they work like a slow release capsule. So they can give you consistent amount of energy throughout the day. In that case, there are some choices which are really good. There should be one serving of dairy, either milk or yogurt or anything made out of it. So it should be there. And if we add some fiber like chia seeds in that milk or yogurt, they become also, they provide consistent energy for a longer period of time because chia seeds have more iron, more calcium. So it's more nutrient dense. Other than that, egg, some kind of protein, egg or kebabs, but in a low fat manner. But if we had to add fat or oil or olive oil, any good fats, they should be taken more in the seri than the iftar because we have to keep in mind the obesity factor as well. So, if, for example, if we are required to have in a low fat diet, if we should be having 3 teaspoons of oil per day, then 2 teaspoons should be in sehri and 1 teaspoon should be in iftar. So that's very important that more fat should be in the sehri so they can give you consistent energy throughout the day. And so a protein, some 1 to 2 teaspoon of oil on your bread, the brown bread or the whole wheat bread. No white bread because it's a high glycemic index and they will give you spike in the blood glucose level after, especially after 2 hours after the seri. And if you add some lentils or some chickpeas in that category, they provide you carbohydrates, complex carbohydrates, as well as they provide you good fats, and also provides you protein. So these are the good items to be consumed during the seri. From the diabetes point of view, so no simple carbs, no simple sugars, no white flour should be there. Rice should be avoided because it will can give you a spike in your blood glucose levels 2 hour postprandial. But when you're coming to the iftar, then there should be a small snack. Well, I'm not talking about a person who does not have diabetes. I'm talking about a person who has type 2 diabetes. So it's only 10 to 15% carbohydrate should be coming in iftar time. So it can be a simple milkshake, low fat milk with a fruit, and artificial sweetener can be used. Or if there is a sugar free beverage, then any fruit can be taken, like 2 to 3 dates, or any low glycemic index fruit like an apple, or maybe a mixed fruit chart without added sugar, or maybe half a cup of 1 cup of aloo chana chaat can be taken, or maybe half a sandwich. So it won't bring a spike in the blood glucose level. Then there should be a break for namaz and stuff, and then comes the proper dinner time, where should 40% of the carbohydrate should be coming. So those 40% carbohydrate should, there should be a whole wheat bread or rice with some veggies or protein in it. So it won't bring the spike. Their white plain rice can definitely bring a spike in the blood glucose level, and in the appropriate amount, like not more than 1 cup per day. There should be salad a part of it. The most crucial part is the hydration. It's best to have an allocated time. Like if the fasting is if the fast is open at 6 o'clock, you are having a beverage or a fruit or small amount of healthy snack like aloo chana chaat or fruit chaat, and then you are having a gap of 30 minutes or 1 hour, and you are having a dinner around 7:30. Then you should start hydrating yourself from 8:30 onward. From 8:30 onward to 10 o'clock, at 10:30 should 1 liter water should be consumed. It can be flavored, like sugar-free drink sachet can be added, or some kind of like in Pakistan we have a trend of kachi lassi, that a small amount of milk or yogurt with large amount of water with salt should be added. Salt not for those who have hypertension, because then you have to be restricted. Or artificial sweetener can be added for making sweeten it a bit. And then, if there is a need, 10% carbohydrate can be consumed as a late night snack. The preferred snack should be milk or yogurt in the low fat version, or half a sandwich in a brown bread with some protein in it, or in salad. Coming to the physical activity, when the person with diabetes are fasting, they should not try to fast during the fasting period. They should try to go for a walk or exercise or physical activity after opening the fast. So they have a margin to complete their physical activity duration without having an hypoglycemia event. So physical activity should be done after the iftar. Hydration is important, and there should, when they are fasting for the day 1 and day 2, there should be 7-point testing. Blood glucose monitoring should be done. Blood glucose should be checked before the Sehari, then 2 hours after the Sehari, then around 12 noon, then 2 hours before the iftar, and just immediately before opening the fast, and 2 hours after opening the fast. If all the foods, if all the blood glucose levels are within the normal range, then definitely that person is showing a very excellent level of discipline in their life, and they are making sure that they remain fit for fasting. I hope these things will help the people who are struggling with diabetes, obesity, and also want to have their connection with Allah subhanahu wa ta'ala. And may Allah accept the ibadah of all, and every effort counts. So living your life in a disciplined way is according to Allah's uh, uh, recommendations. So we can help them, being dietitians, organizing their dietary habits for healthy fitness, healthy fasting with fitness in Ramzan. Thank you so much. Thank you.
Thank you so much, ma'am. Thank you so much for such an insightful talk. We have learned a lot of it. Thank you so much once again for your precious time.
Most
Now,
welcome.
moving forward to our next distinguished speaker, it is a privilege for me to introduce Dr. Amna Naseer Abbasi. She is the director of Bariatric Surgery Program and a modern nutrition scientist that bringing together clinical excellence and advanced nutritional science in the field of metabolic and weight management. With her leadership in the bariatric care and deep understanding of modern nutrition strategies, she plays a vital role in improving patient outcomes through an integrated evidence based approach. We are honored to have her with us today. Please join me in warmly welcoming Dr. Amna Naseer Abbasi to present her talk in 7 minutes. Thank you so much, Ma'am Amna, for joining us. Please start your talk. Dr. Amna, are you there?
Assalamualaikum. Assalamualaikum.
Walaikum Assalam.
Can you hear me?
Yes, ma'am.
Okay. Assalamualaikum, everyone. So today we are going to discuss a very important topic, but very neglected topic as well. सबसे पहले तो मेरा एक क्वेश्चन आप लोगों से, कैन यू प्लीज टेल मी कि कौन कौन से लोग हैं ऐसे जो कि सहरी को स्किप करते हैं? एनीवन प्लीज? आप थोड़ा सा इंटरेक्टिव रहेंगे तो हमें मजा आएगा बात करने में. एनीवन? सब जाग रहे हैं? अच्छा. सो ऐसा है कि रमजान में क्या होता है कि
Excuse me, ma'am.
जी जी प्लीज, कैन यू हियर
Excuse
मी?
me, ma'am. Really, yes, ma'am. You are audible. It's really sorry to interrupt you. Uh, we have audience from different regions at international level. So,
Right.
can you present in English? And
Yeah,
I have a little announcement for the audience as well. To please, the meeting is going to end in 4 minutes. So please rejoin from the same link. Uh, no, ma'am, you can get start.
all right. So Ramadan is not only a spiritual reset. So it is also a very powerful opportunity for us for a metabolic reset. So today we will talk about something very important, and also, as I have discussed earlier, that it is ignored, and that is healthy Sehri. Because what you eat at Sehri decides your energy, your mood, and even your ibadah quality for an entire day. So I have a quick question for you. How many of you feel tired, sleepy, or get headaches by 12 p.m. during fasting? Anyone, please? Anyone? आप मैसेज भी कर सकते हैं. You can just hit heaven. Okay. Okay, fine. So that usually means that the Sehri was not balanced. So today we are going to learn. Yeah, you can text. You can text. All right. So today we are going to learn how to build a smart Sehri plate, right? So that keeps you energized and during 14 to 16 hours. First of all, Ramadan teaches us discipline, but nutrition gives us strength to maintain that discipline. Healthy Sehri is not about eating more, it's about eating smart. And today I will show you how to do that in simple and practical way. First of all, let's understand first what actually happens to our body during fasting. Then move to blood sugar changes, hydration, protein importance and fiber. There are some macronutrients and there are some micronutrients. Macronutrients include, these are carbs, these are proteins, and these are fats. Then carbs have different types. There are some complex carbs and there are some simple carbs. In complex carbs, these are your complex carbs include your vegetable, your chicken, your multi-grain atta, your oats. And simple carbs, it's simple sugar. When you eat sugar, then your energy level, your sugar level spikes, then you feel lethargic. So these are some macronutrients. Then come to some micronutrients. मैं आपको एक एग्जांपल देना चाहती हूँ. एक कार होती है, ठीक है. मैं बाइलिंगुअल यूज कर सकती हूँ ना मैम, ऑर्गेनाइजर. सो एक कार होती है, उसको ना फ्यूल चाहिए होता है. सो वो जो पेट्रोल होता है वो कॉम्प्लेक्स कार्ब्स होते हैं. कार ऑल्सो नीड सम वाटर, some for tuning. These are these micronutrients and these are vitamins, iron and metals, zinc. So हमारी फंक्शन करने के लिए बॉडी को नीड्स माइक्रोन्यूट्रिएंट्स. Then comes second source are protein source. These are complex carbs. There are animal based proteins, there are plant based proteins. Animal proteins based proteins include chicken, fish, your meat, your egg, your milk, cheese, paneer and yogurt. Then come plant based protein. These are lentils like